Toe, and I am so glad that you decided to join me today. I am excited because I have a special guest on with me. We are thick as thieves. She's my best friend. She is a Christian, a mother, a women health nurse practitioner, and she's all around awesome. Her name is Ashley Ayu. So, woo, welcome, Ashley. Beep, beep, beep. So I'm just super excited because she has a lot of wisdom in the medical field, but then she also has a lot of wisdom just as, being a woman of God. And so she provides me a lot of wisdom and insight for my life. And so I know that she'll provide you with the same encouragement. Um, so welcome, Ashley.
Thank you. Thank you. I'm so excited to be here. I can't wait to dig into it.
Okay, good. All right. So, as I said before, she is a licensed uh women health practitioner. I'm fumbling a little bit, but um so I wanted to come from the framework of where I talked about last time. So in my last episode, I started to share a little bit about my story of how, from aborted to basically having purpose now. My story encompassed like my mom, wanting to abort me, but then, later changed her mind. And from there, that's where my story began. And so today I want to kind of, piggyback off of that with you being in the medical field, how, you've seen the ins and outs of what these women go through. And so I wanted to get your perspective from the medical side, but then also from just a Christian standpoint as well. Um,
Mhm.
so
Yeah.
yeah, so go ahead.
The topic is a loaded one, right? Like, I've been a nurse for almost 10 years and have been working as a women's health nurse practitioner for a little less than a year now. And just in my time in healthcare, I have seen a number of women um, explore the option of abortion or either have miscarriages. So kind of spanning the spectrum of pregnancy loss, right?
Hmm.
Um, and there is multifactorial. It doesn't just have like medical implications, but there's spiritual implications, there's emotional implications, there's relational implications, there's
Right,
social implications. Like
right.
it spans over across a lot of areas of our lives, and it's kind of like a hot button topic, right? Like in my profession, um, abortions have been there's been a change in the discussion around abortion, even recently due to political influence,
Right.
right?
Of course.
And so the government being able to now have a hand in women's reproductive rights and um, what they choose to do or not do with their body is now something that I'm having to consider
Right.
as a practitioner. Now, in my practice, I don't perform abortive services or provide that type of medication management for patients. But
Okay.
even in my patients who are miscarrying and certain medications that we prescribe them have been historically known to be used for abortions. And so there's some hoops I have to jump through around that now that I
Right.
didn't have to jump through before.
Wow.
So that being said, um, coming from the perspective of a medical professional, when I see patients in my office, as of lately, I've actually have one that sticks out in my mind who recently had an abortion. And I know that in the medical field, a lot of doctors or providers aren't known for really investing in the patient
Hmm. Hmm.
personally,
Right.
taking that time to kind of explore all of those factors that I mentioned earlier that plays into, what's going on surrounding the decision to abort, right? And so
Right.
I had a patient recently, a younger girl, came into the office with a common complaint and found out just kind of by way of testing for
Hmm.
other things that she was pregnant.
Okay.
Um, and when we determined that she was pregnant, we let her know, you can follow up for a new OB appointment if that is your plan,
Right.
and make a scheduled appointment for that, and we'll follow you throughout. And we didn't hear from her for several weeks until this past week when she came into the office and was interested in birth control. And at
Okay.
this time, she had aborted the previous pregnancy.
Okay.
And so, in talking to her, I could tell that there was a lot of emotional work that she was still kind of working through.
Right.
Um, and so, for my patients, I always like to assess their mental health
Mm.
to see whether or not they're dealing with depression and anxiety, any mood
That's good.
disorders, um, and offer resources for that.
Right.
Because I think a lot of times providers can look at a patient like that and treat it episodically as, oh, she had an abortion, she's here for birth control, those are the things we're dealing with, and that's it.
Hmm.
Um, but
And
that's
that's
not
exactly
it,
right.
right?
Right. So that's what I wanted to get into because exactly like what do you believe that these women are experiencing or going through in that mental health, like that mental stage? Because a lot happens. Like you were once carrying a life and then you wasn't. And then there's just so many different factors, going into that. So what can
Yeah.
you share?
So, and I kind of lump these patients in together, although they're two very distinct experiences, patients with abortions and patients who have miscarriages. But I
Mm-hmm.
find that there are a lot of overlapping emotions in that,
Okay.
whether it be grief of what was lost and what can now not be experienced.
Yeah.
So, something that is now taken away from them.
Right.
Um, Having to make the difficult choice of deciding whether or not to do said thing based on whether it be you're not in a relationship with this person or you don't want
Mm.
to have a baby with this person, or it's just not the plan that you have for your life at this time. You're not financially stable. You don't have the support system intact. Whatever those factors may be, um, that leads a person to that decision. Um, but grief probably would be the number one thing. And then fear of the
Hmm.
unknown,
Of
as
course.
far as, okay, now I've done this thing, or in a miscarriage, this thing has happened to me. What does that mean for me and my fertility going forward?
Right.
Will I be able to have a baby safely? Did I mess up my body? Will God
Yeah.
punish me for this? That's like,
Yeah,
a,
you're going into you're going into where I want to go next because I think
yeah.
that's the one thing like I've shared that although, I was going to be aborted, I too I believe that there is and I believe you believe this too, but I believe like the spiritual connection between mom and baby is there. And so like the fact that the thoughts are there to abort, the feelings of, to abort or to abandon, the rejection, and you talked about fear a little bit earlier, like all those things are like all intertwined. And
Mm-hmm.
so, like, can you talk to a little bit about that? Because I know for me, like, being young, struggling with those, emotions myself, not necessarily knowing where they're coming from, but
Yeah.
they all are like kind of tied back to that initial conception, phase.
1000%. So I'm a medical professional, but I'm also a believer, right? Um,
Right.
and so I believe that life does start in the womb at conception. With that being said, I can go on a tangent on this
Yeah.
because I'm very passionate about it. The scriptures talk about life being in the blood, and it doesn't matter, when a lady miscarriages, whether she's 8 weeks or 24 weeks,
Right.
she bleeds,
Yeah.
right?
Yeah.
So there's life there. There's something there that the Lord has breathed life into, even
Mm,
though this fetus has not taken its first breath. The Lord has ordained there to be life there.
yeah.
Okay? And so, from a spiritual perspective, and I think we even see this scientifically, where we look at these things called ACEs. And let me pull it up so I can reference it appropriately. But
Yeah.
a lot of times we look at these things called ACEs, and what ACEs are is adverse childhood experiences. And these outcomes or these experiences are things that children have experienced from a young age, and then how they affect them physiologically as they grow up. So, if any of these things, say it may be divorce or domestic violence in the home, or
Hmm.
um, any number
Trauma.
yeah, things that can impact them or triggers.
Hmm.
The study shows a correlation between these things that happen in early childhood and health outcomes. That
Right.
there is a correlation between them.
Right.
Now, for me, I even venture to take it a step further and say that not only in early childhood do these things then affect a person physiologically and mentally,
Hmm.
but in the womb
Yeah.
it starts, right?
Yeah. For
Like,
sure.
spiritually, you are connected physically and spiritually to your mom. And a
Right.
lot of times we counsel our patients, like, manage your stress in pregnancy. If there is postpartum depression or perinatal anxiety or depression during the pregnancy, there
Mm,
are outcomes associated with that. That spirit filled baby inside of you
right.
is encountering all of those emotions, is
Yeah.
encountering all of those fears, all of those anxieties and things. And I believe that it does materialize in certain ways and shapes and forms.
Yeah. For
Um,
sure.
Maybe I should do a study on it.
No, but for real, no, I can attest to it because, like,
Mhm.
even with my youngest baby, like, when I had a lot of stress going on in my life, like, I ended up having her early. And it
Mhm.
was because, like, of all the outside factors that you're talking about, the ACEs, that cause for stress, for me to be triggered by things. And then it triggered for her to come early. So, yeah,
Yeah, for
I
sure.
totally agree.
Like, we see on the medical side how stress affects the body.
Hmm.
It can increase your blood pressure. It can
Right.
cause your glucose to increase because your body's natural stress response is to shoot up cortisol. And so, if your cortisol is constantly pumping up, you're at higher
Yeah.
risk for diabetes. So, these things that our body does in response to stress while you're pregnant, that can induce preterm labor, that can cause for a smaller child.
Hmm.
Because if you have hypertension in pregnancy, chances are baby's not able to get all of the nutrition and things that they are supposed to get because your vasculature is not working properly, if that makes sense.
Yeah.
Um, so there's a lot of correlation between, the things that happen to us and how we deal with things mentally and spiritually and how our body responds to it.
Right.
Yeah.
Right. Now, you can ask, you can say yes or no. Now, have you like personally encountered, some things, um, not similar, but like besides work, have you encountered something like this,
Yeah.
for yourself or someone in your
Yeah.
family, and how have you like gone through and
Yeah.
made it to the other side of that,
Yeah, for
or
sure. Well,
working through it, I should say.
yeah, obviously because you are my best friend, and so
Yeah.
in my history, I have experienced miscarriage myself, and a lot of things came with that I didn't expect. I didn't expect one for that to be a part of my story, right? And that's, I think, a lot of the times things we take for granted that, I'm married, I'm doing things right, and it should just happen for me, you know?
Mhm.
And when it didn't, and I miscarried, um, I still deal with the grief that I'm not able to fully articulate.
Yeah.
And I have my beautiful number one son
Yeah.
with me right
Hey,
now.
boo.
Give me one moment, baby. um,
It's all good.
and so when that happened, I was
Yeah.
when I first found out. Let's start there. I was excited, a little nervous
Mhm.
because second child. I
Mhm.
know what the first child was like. How is
Yeah.
this going to change our family dynamics? How is this going to impact our finances? How is this going to impact how we live day to day? All of the things you get concerned about when expanding your family.
Right.
And then I remember having some bleeding and kind of, again, taking for granted that everything's okay. This happens commonly, in pregnancies. And so maybe it's nothing. I'll get checked out at my 8-week appointment and everything will be fine. And so
Mhm.
my 8-week appointment comes and they're not able to see anything. And at
Mhm.
that time, there was a lot going on. I was in school to become a nurse practitioner. I
Mhm.
had a 2-year-old son, married and working.
Mhm.
And about to start my clinical rotations in the next semester. So there was a lot of things going on. And I
Yeah.
was very much stressed.
Mhm.
Um, I also was not taking my birth control as prescribed.
Mhm.
In
Uh-oh.
part because there was just so much
Yeah.
going on, that I would forget.
Mhm. Mhm.
And so I remember driving home and kind of being, sorry guys, kind
No,
of
you
being,
good.
being just kind of in a numb state.
Can you sit,
Yeah.
And
Mom, can you sit this down?
okay, thank you. All right, go downstairs for me, baby. I remember being in a kind of a numb state, just driving home. I called my husband. This was during COVID time, so
Mhm.
he wasn't allowed to come to the appointment. And
Mm.
I tell him what's going on, and I kind of, just sit in this state of disbelief,
Right.
and also kind of waving it off in a sense because I didn't have the time to deal with it at that
Mm.
moment. My emotions about
Right.
it. And if I'm honest, it wasn't until about 2 years ago, 2022, that I really dealt with the grief of that miscarriage.
Yeah.
Um, One of my other best friends, she also experienced the similar situation, and as she went through her grief, I
Mm-hmm.
found myself actually, she was putting words to my experience.
Mm, that's good.
And I was able to feel what I couldn't feel in 2020.
Right.
And the things that I felt was the missing out on what could have been,
Right.
um, the anger for
Mm-hmm.
feeling like my body didn't do what my body was supposed to do,
Mm, yeah.
um, the loneliness of feeling
Yeah.
like, in part, I went through it by myself, um,
Mm,
which is a whole nother topic.
yeah. Yeah.
You know, men experience these things differently than women do
Of
because
course.
it's not their bodies, right?
Right.
That's not to say they don't experience it. It's just in a different way.
Yeah.
So having to navigate that, um, and feel like I still had to be on.
Mm-hmm.
Be on for school. I had to be on for my son. I had to be on for work. I had to be on for my husband. Um, and so it took some counseling,
Yeah.
definitely,
Right.
to walk through some things, and heal. And it's not 100% healed, right? I don't know
Right.
that that space will ever be 100% healed. Like, I'm a mom of two.
Right. Of course.
My second baby is just in heaven.
Yeah.
And God knew that. And for reasons I'm still 100% not sure of, He allowed that to be a part of my story. But even in it, He's still been faithful in teaching me the beauty of motherhood
Mm,
and the beauty of even being able to give love in my womb for the short period of time that I was able to do that. And so
right.
I'm grateful for that. So,
Wow. You shared that so beautifully, Ashley. And I was just thinking like this is probably why you are such an excellent provider
mm,
because you have, I mean, you already had compassion before all this even happened, right? But you can sympathize
mhm,
with them. Like it reminds me of scripture how like Jesus, he sympathizes with us because he's been through you know, the fire with us. He's been there. He sacrificed his whole, you know, his life for us. And so it makes me think of that, like, not saying that this was
mhm.
something good for you to go
Yeah,
through,
no,
not at
no.
all.
I
But
no, I 100% agree with that. I mean, we are in a broken world and we encounter brokenness, and we
yeah,
don't escape it just because we believe in Jesus Christ. He
right,
encountered suffering, he endured it,
right,
and the scriptures say that we will, in this life, there will be suffering. And so
yeah,
I do think that, in part, I've always known the Lord gave me a word way back in maybe 2010, 2011, that I would be working with women.
hmm,
And I I always knew that I would be, and my heart has grown for the maternal health world, and
hmm,
women and their families in that space. And there is a difference when you have had experiences, certain types of experiences, and you encounter these patients in a different way, because I've
Mhm.
had providers who I've witnessed be very callous and hard. I've experienced it myself personally,
Wow.
with my miscarriage, and I had a follow up call, and the doctor said, "Hey, I'm just following up with you. Your hormone levels are pre pregnancy. When you're ready to try again, let us know."
Wow.
And that was the
Like,
conversation, you know?
wow.
And so having my experience has definitely lent itself to being able to empathize and care for
Mhm.
these women in a different way. Even my follow up with these women,
Right.
um, I'm sometimes carrying it out a little too far, I think, for some of them, to be honest. Um, because I want to make sure that not only do you know 100% what's going on with your care,
Yeah.
but that you are being cared for and supported in the ways that you need as you navigate a loss.
Right.
Um, and I find that a lot of them take value in that. And then I gauge and I say, if this isn't something that you want me to follow up on, let me know.
Mhm.
As far as, their mental health and things like that. But I always leave that door open, because
That's
you just
good.
never know what a person may be on the verge of in the event of something like that happening.
Right. Th-
Um, yeah.
And yeah, no, I was want to say that that's good because like when it comes to anyone who is experiencing something like that, like you said, no one knows what their head is at or where they're what they're thinking or how they're even going to navigate through that. And so I guess like my next question to you would be like, and I'm sure that there are ways that you said that you've coped and got through it, well, or getting through it is through counseling. Do you all provide that same type of counseling and like resources to the women that you encountered, or like how does that work?
Yeah. So in my network, the organization I'm in, we have a behavioral health organization called Mind
Okay.
Doula.
Okay.
And we refer to them, they are behavioral health counselors, and they deal with everything from anxiety, depression, to bipolar, to perinatal anxiety, depression, postpartum depression, anything you can think of. They will reach out to them, send in a referral to our patients. Ideally, they get in contact with them within 5 days.
Mm.
I'm usually following up with my patients at the end of that week to see, have you heard from them? Have you reached out to them? Has an appointment been set up? Um, and what Mind Doula will do is an initial consultation with a behavioral health specialist. They'll kind of do the intake and assessments to see what exactly it is they're dealing with on the mental health front. And
Mm.
then a psychiatrist will come in, read the assessments, and provide recommendations to the providers. So they'll provide recommendations to our offices, whether it be in person therapy or medication management or some other type of follow up. Once they provide those recommendations, I go forward and either submit another referral for a psychiatric evaluation, or Mind Doula will take over that recommendation and follow up with the patient in that way. And so we kind of have this closed loop system of me sending a referral, them contacting the patient, doing the intake. The intake reports come back to me, and
Hmm.
then either myself or my doula um, responds based on the recommendations, and the patients follow up that way. And so they continue to reach out to them on a weekly or biweekly or monthly basis, depending on the severity of the situation. And so that's one of the primary resources that I use, and I like the fact that they provide us with the reports that we need to see how it's going, because I'm not a
Yeah.
mental health professional, right?
Right. Right.
So there's a limit to the care that I could provide in that specialty.
Hmm.
But when they send in the documentation to show me, how things are progressing or regressing, when I see that patient next, I'm able to follow up appropriately.
And that was my next question because I know that of course, you're facing it from one side of the picture. And so, um, it seems like they're getting all the care that they need for like the physical, the mental, but now I'm thinking about even like the spiritual aspect. Like, I know you can't directly like minister to them at work, but they're also like how can, like, say the woman happens, and I don't know if you had this cases happen before, in your office, but like say a woman who was abortion minded and didn't go through with the abortion, like what then, like is there, like, do you still go through the same process with the
Mhm.
resources, or do you send them more so to like mental health, and
Mhm.
then, or like do they go to counseling with maybe church groups or different connects
Sure,
outside? Yeah.
sure. So I have sent my patients. So I think I'm a provider who might do a little bit more, to be honest, because I'll look at where my patient lives, and then I'm looking at support groups in their area, whether they are
Mm,
affiliated with the church or not.
okay.
Um, I will look at virtual options depending on the patient's ease of access, whether or not they take public transportation or have a reliable car or anything like that.
Wow.
I want them to be able to have access to quality care. That's
Yeah.
like the priority. And so I'll take the time to Google search, read reviews, see
Hmm.
what people are saying about their experiences in different groups and settings, and then I'll send that to my patients, and I'll follow up with them if they to see if they followed up. And now
Hmm.
there does come a point where, as a provider, I can only do as much as the patient desires to do for themselves, right?
That's right. Yeah.
And so I follow up to a point, but I want to at least, at the very minimum, equip them with resources that I know could be helpful for them and educate them on, the risks and the risks of mental health difficulties and concerns, and then the benefits of seeking adequate help.
Yeah.
Another thing that we're doing in one of my offices that I cannot wait to begin is a centering practice, and
Nice.
it's basically group prenatal care. And the reason I love that we're getting ready to start this is because it creates a network for these women who are having children, whether they be first time moms or a mom of five and just is trying to figure it out, or whatever the case may be. All
Right.
of these women get to meet together and bond because they're pregnant and around the same due dates. Um, and they get to share their resources, and they get to share their stories, and they get to
Hmm.
share their knowledge and support one another. And there's some research out there that shows our relationships that we build, the impact that has on um, our health outcomes. Like
Yeah. Talk about
there,
it.
yeah, there's a positive correlation between
Right.
healthy relationships and touch and
Yeah.
feeling known and seen and heard that correlates to positive health outcomes. I mean,
Yeah.
we are made for one another. I was telling a patient that today.
Yeah.
We are made for one another. We weren't meant to live in this world in isolation. And so when we get to a place where we can build support and build rapport and networks and relationships with one another, what better way to do that when you're pregnant and
Yeah, of course.
it's an amazing thing. So I think um, that is one way that I'm really, really looking forward to providing some support to these women who might be dealing with postpartum depression or perinatal depression and anxiety. And in those groups, we can also bring in outside people. So we can bring in a social worker or a behavioral
Mhm.
therapist or a psychiatrist to give them resources and talk them through their experiences. Because a lot of times we're just going through the motions, but we don't take a breath or a moment to feel what we're feeling or to know
Yeah.
exactly where we are. So,
Yeah, that's actually legit because I mean, as you know, like I've been there as far as like the postpartum depression and it you don't realize how much or how deep you're in until like you start spiraling out.
mhm.
Um and so it's awesome that your team that they're about to like embark on this new part cuz I was going to ask like too like medical hat off like how like as just a sister in Christ like how can we support women in our local church and our local body who may have been abortion minded but then decided to have the child or who decided to go through with the abortion like how can I or women in general or men in general help show support and love for individuals? And I know you touched on it a little bit earlier about relationship, like having genuine relationship.
Mhm.
But is there anything else that you can think of that can help like share some light on how we can provide support to them?
Yeah. Um, Definitely showing up and being present
Yeah.
um, is huge. Um, you can't beat, just being there for someone. And a lot of people don't realize how much that matters to people,
Yeah.
but it matters. And it means a lot when you are wholeheartedly present and willing to inconvenience yourself for a person
Hmm.
or just share your time and your energy. Another thing is sharing resources. Like
Hmm.
if you have the resources, whatever it might be, to share, to encourage these women to keep going, you
Yeah.
know, a lot of the times people feel stuck and like
Yeah.
they don't have options.
Yeah.
Um, But if they know they have people in their corner that's going to support them, encourage them, help them see different perspectives, and shift their perspective, I think that's very, very helpful. A little plug here there's another group called Embrace Grace.
Yes.
And this group, you know about them. We
Yes, I do.
heard about them at the Glory Conference with Jackie Hill Perry, and
Right.
they have kind of little outposts all throughout
Mhm.
the country for this specific thing. So you can hop on their website, find
Right.
support groups that may be near you, and enter those where there are women there who have contemplated abortion or are probably still contemplating abortion,
Mhm.
but are there to find support and rescue where they need it. And these groups are connected to churches. And so that's a beautiful benefit for a lot of people, because not only do you get this network, then you get plugged into the spiritual home potentially, um, that gives you so much more than what you could have ever asked for. Um, so yeah, the biggest things is being present, but there's also other options out there of how you can support these women.
Well, I thank you for sharing all that you have shared today. You're awesome. And I just thank you for, like, being willing to, give so much of your time and share, like, what God has purposed you for, here on this earth. And I'm glad to be a part of your circle and be a part of, seeing God work through you. And so, yeah, I will put the link for Embrace Grace in the description. And
Yes.
then I know another organization called Young Lives. They have many chapters in Maryland and throughout the country. So if you're looking for any resources to help you if you are abortion minded, um, or if you had an abortion, you can also reach out to these agencies as well, and they will help you. And don't be afraid to reach out even to me if you have any questions. I will definitely try to answer them.
Mhm.
And so I will just like to thank Ashley again for coming and sharing her wisdom. And so if you like this video, go ahead and subscribe to my podcast. And again, that is the end of the In His Radiance podcast. See y'all later. Peace.
Bye.
Bye. Oh, wait.